Welcome to this overview of atrial fibrillation, focusing on diagnosis, treatment, monitoring, and risk groups as outlined by the NICE guidelines. Atrial fibrillation, or AF, is the most common heart rhythm disturbance, affecting millions globally. Understanding it is crucial for effective patient care. AF causes an irregular and often rapid heart rate, leading to poor blood flow. This significantly increases the risk of stroke and diminishes a patient's quality of life. The National Institute for Health and Care Excellence, or NICE, provides comprehensive, evidence-based guidance to help clinicians manage AF effectively. The first step, as per NICE guidelines, is accurate diagnosis, which relies heavily on recognizing key symptoms and using appropriate testing. Initial assessment involves looking for common symptoms like palpitations, breathlessness, and fatigue. A thorough patient history is essential. The definitive diagnosis of AF requires an electrocardiogram, or ECG, which confirms the irregular heart rhythm characteristic of the condition. Identifying patient risk groups is a critical component of AF management, especially for determining the need for anticoagulation. High-risk patient groups often include those with prior strokes, heart failure, or uncontrolled hypertension, all of which increase the likelihood of complications. NICE recommends using risk stratification tools like the CHA2DS2 VASC score to accurately assess stroke risk and guide decisions on preventative anticoagulation therapy. NICE guidelines offer clear pathways for AF treatment, focusing on managing symptoms and preventing stroke. Treatment often involves a choice between rate control, aimed at slowing the heart, and rhythm control, focused on restoring a normal heart rhythm. The choice depends on patient symptoms and clinical assessment. Anticoagulation therapy is crucial for stroke prevention in high-risk patients, typically involving direct oral anticoagulants, or DOACs, or warfarin. Ongoing monitoring is essential to ensure treatment efficacy and to address any changes in the patient's condition. A long-term monitoring plan should be established, including regular reviews of symptoms, physical examinations, and assessment of stroke and bleeding risks. It is important to adjust treatment promptly based on the patient's response and any changes in their clinical status or risk profile. Managing atrial fibrillation effectively requires a structured approach guided by comprehensive clinical guidelines. Key NICE recommendations include rigorous risk assessment using CHA2DS2 VASC, preference for DOACs in most patients for stroke prevention, and the use of individualized treatment plans. Adherence to these guidelines is crucial for ensuring patients receive consistent, high-quality, and evidence-based care for their AF.